My dear awesome friends, all of my viewers, welcome back. Have you ever witnessed a very undesirable, sad thing in your life? Yes, it is not at all desirable, but I have witnessed. I have witnessed one player in the cricket ground suddenly collapses and thereby on the way to hospital after few hours of struggling in the hospitals he passed away. It happened in Zambia a couple of years back in a cricket ground. And very recently, I came across similar type of sad news in India when on 31st May 2022, the famous playback singer Mr. KK, Krishna Kumar Kunath, has passed away. Following a program in an auditorium in Kolkata. And that program has taken place in an auditorium named Nazrul Manch. It was said, as per the report of newspapers, that auditorium was fully engaged with people and it was filled up more than the 3 times of capacity of this auditorium. And it is quite unexpected in a program of the college social function to gather such a number of people. And the newspapers alleged that it was the callousness of the organizers which led to death of KK because of suffocation. Now the question arises, if the reason for death is suffocation, then why didn't it happen to the other person, anybody in the hall? It had not happened to anybody, only unfortunate and hapless KK has suffered. It was also fact that during the program itself, Mr. KK has felt a lot of inconveniences and sometimes he requested the organizer to switch off particular lights or to control the sound of the sound boxes so that he can feel something easy. But anyway, like a good professional, he completed his programs and after program he straight went to the hotel, and after going to the hotel he again felt some inconveniences, a lot of sweating, palpitation, anxiety, and then he has to rush immediately to the hospital. In the hospital, doctor tried a lot. It was definitely emergency situation, but he passed away. A very sad incident. And it is a premature death only in the age of 54 years. Totally uncalled for. Nobody has expected it. It is a loss to the society. It's a loss to the Bollywood film industry. It's a loss to the country to lose a promising singer. And definitely the big loss is to the family itself. If you ask what was the lifestyle of KK? The lifestyle also not very serious. Means he was a total family man. He came to the home very timely. He never smokes. He doesn't indulge in alcoholic drinks. But again it happened to him. So what was the real reason of his death? After his death, his body was subjected to postmortem. And from the postmortem, it was revealed by the doctors that reason for his death was the sudden cardiac arrest. And they are saying the reason for cardiac arrest is due to VF. VF is ventricular fibrillation. What is fibrillation? Fibrillation is the process of forming fibers in the muscles. And ventricular fibrillation is the process of forming abnormal fibers in the ventricle portion of a human heart. And because of these abnormal fibers, the heart muscles become a bit harder. And because of this, during the heartbeat, it loses rhythm. And this particular condition is called arrhythmia. And due to this arrhythmia, what happens? The heart fails to send blood to the lungs through pulmonary artery. And that is the reasons that heart never gets back oxygenated blood returned from the lungs. Let us understand a bit what is this system of blood circulation in human body. So heart is a very important organ in our body. The function of a heart is a pumping instrument. Heart has 4 chambers. The 2 atria or auricle and 2 ventricle. So left atria, left ventricle and right atria, right ventricle. 4 chambers. In this system, de-oxygenated blood comes from all parts of the body and get deposited in the right atria first. And in the right atria, there are some cells called the sinus nodes. These sinus nodes generate electrical pulses. And these electrical pulses send the signal to the valves in between right atria and the right ventricle. And when the valves remains opened, the blood is transported to the right ventricle, lower chamber ventricle. And from that right ventricle, another pulse is transmitted. Okay, that pulse is AV node. AV node is a bunch of cells situated in the ventricular region. And it may be treated as a electrical relay station. And in the relay station, what happens after getting the electrical pulse from the sinus node? After some delay of the time, it sends the electrical pulse to the other areas, whereby the valve in between the right ventricle and in the passage towards the lungs through pulmonary artery that is opened. And blood is transported to the lungs area to get purified. And in the lungs, the blood becomes oxygenated blood. Oxygenated blood comes back in the left atria. And from left atria, blood again goes to the left ventricle. And from left ventricle, blood actually circulates to all over the body, including the brain, legs, hands, everywhere. This is the transportation of the blood systems in a nutshell. So I know it is quite easy for you to understand now. But in case of VF, ventricular fibrillation, the ventricular regions experience the quiver or sudden twitch. Twitch is a formation of a jerk or convulsion. Most of the time it is involuntary. And because of this convulsions, it loses the synchronizations in the beating. And thereby, heart cannot send blood to the lungs and it cannot get back to the purified blood, oxygenated blood in the heart. And this condition is called the myocardial infractions, that is the lack of oxygenated blood in the heart. And this was the real reason for the death of singer KK. It's definitely a serious condition and emergency situation when patient feels a chest pain, anxiety, sweating, and lot of uneasiness feelings. And sometimes he felt the loss of consciousness as well. So this condition definitely emergency situations, and people must be consulted to the doctors immediately. Doctors knows what to do. There are two preliminary treatment of these things. One is called CPR, cardiopulmonary resuscitation, and another is sending artificial electrical pulse through AED, automated external defibrillator. Okay, this device. So had the patient rushed to the hospital timely, they could have been saved the life. Many a time what happens because of unawareness of general public, it happens. Many a time we just do something mistake, as it was mistaken this time also, that my chest pain is because of the indigestion or something else we neglect. But my dear friends, it is such a thing not to neglect your health. If you feel at any time, or if you heard that any of your relatives or friends are feeling this type of situation, go and immediately take the patient to the hospital, and doctor knows how to treat them. I hope I have conveyed my message for general awareness of public, and henceforth with a positive hope that we can save some life in future. With this preliminary knowledge, I will be more than happy. My dear friends, bye for the time being. I will again come back with more and more important informative videos to you. Bye.